Good morning, everyone, and welcome to June's Legislative Advocacy webinar. Tony, take it from here.
Good morning, everybody. Thank you so much for joining us today. Actually have, for such a limited session, legislative session at the state level, we actually had we have quite a bit to chat about today, especially surrounding House Bill 483, which is the mid-biennium review budget bill, which was actually passed on June 5th. It passed the House and passed the Senate. There were it was not even along party lines. There were just a few votes that that didn't get it through. Or I guess it did get it through, but there were some concerns on both sides. But it did finally pass on June 5th after a conference committee. Basically, I've listed out how the funding. There was a question of the $47.5 million that was originally allocated to boards for the additional opiate problems that have been going on around the state. That was in lieu of the Medicaid expansion, but since Medicaid expansion had been passed, there was this $47.5 million that was sitting there, and there were some there have been some debates about whether that was one-time money or whether it was dependent upon Medicaid expansion, and don't really want to, I know that there are still concerns over that, still some debate over that, but did want to, this is what we have going forward. So the $47.5 million that was in question, basically this is how it is laid out at this point. $6.5 million for prevention activities at the state agency, the state level. I will talk about those and how those are going to be divvied out in the next couple of minutes. A lot of this money went to recovery, community housing, and those types of things. $7.5 million was an increase for the Residential State Supplement Program. There was $5 million in GRF funds to establish recovery housing beds. Again, there seems to be a theme here. A $5 million earmark in capital community program monies for recovery housing. $4.4 million for county grants to fund caseworkers to assist courts in addressing addiction challenges. Basically, these are drug courts and the state support of drug courts across Ohio. And then there was also $24.5 million for addiction and recovery support with an emphasis on housing. So as this was laid out, you could see that this is really laden with a lot of money for recovery, for housing, and those types of things across the state. Us being Drug-Free Action Alliance being a prevention agency, we have, I wanted to take a little bit of time into the $6.5 million. $1.5 million of that, or a million of it, I guess, is going to be for a statewide survey that the state will actually implement, a survey of young people so that they can have data statewide and not just from communities. I know this was a governor's priority, that he wanted numbers about what it's looking what drug and alcohol use and abuse is looking like for young people across the state, especially as he continues to roll out his Start Talking initiative, which if you know Phil Atkins, he was actually hired at the state level to take over the Start Talking initiative. So if you know him, congratulate him. I know that he will do a fantastic job. Some of the other monies is of the prevention activities, as it says in the language, is planned for coalition building, strengthening that infrastructure. Also, youth-led prevention activities, prevention expansion through youth-led groups is another priority. So it seems like the prevention activities, there are going to be some extra funding. Again, this is one-time money, so it's not something that's I'm sure we will advocate for it in future budget bills that this be continued. However, it's not something that right now there is plans to extend beyond this one-time money. So wanted to kind of update folks on that. Derek, we have a question?
Yes, Fran's question is related to the survey that will be conducted, and her question is, will the state survey collect DFC core measures and have reports specific for each county?
That's what I know that they are hoping at the state level. They're still going through how that survey is going to look, but I think that's a great question and great great suggestion. And Fran, I would get that in. I would suggest that to Tammy Collins and Molly Stone at the state level. I think those are fantastic suggestions. And I know that I will, when I talk to Tammy and Molly, I will also ask that question, try to get an answer back for you. But I think you advocate for that in your communication. So great suggestion, Fran. Thank you so much. And if there are questions throughout this, please let me, please just raise your hand or do whatever. And Derek is closely looking at those and monitoring those, so we can answer those as we go along.
And Tony, I have another question from Steve related to the surveys. Do you know how it's going to be implemented? Will it be through schools? Do they have community buy-in? What are some other things for the details?
It is such a, this was just passed last week. And there was some question about whether this was going to be in the budget, whether the $6.5 million was even going to be in. So those are another question. That's another question that I can surely get you an answer for. I'll give Molly and Tamia a call right after this and get back to both of you. I'll get back to the group with the answers on the questions that we have. So Derek, if we could hold on to those questions, that would be fantastic. And I will get back to you today, hopefully with answers on both of those. So and what their plans are. And if there are any other additional items that they are wanting in the survey, I will forward those on as well. I think that's the questions are great. Also, sharing of information, I think, is absolutely key in making sure that we know what's going on. The partners that are out in the field, all of you, know what is going on at the state level, what their plans are. So I think that is very, very important, and we'll get you as much information as I can today on that. So great questions, and we'll get you those very, very soon.
I'm sorry, Tony, I did have another question from Mary. Her question is related to the rehabilitation housing. Will any of this money be able to be used towards faith-based rehabilitation housing?
There is some faith-based monies, and that will be flowing through actually the Governor's Office of Faith-Based Initiatives. So yes, there will be some monies that will be going through to the faith-based communities. So that is a yes. The other piece of the MBR that there are some questions on, and I think they're quite frankly, I know there's confusion on my part. That doesn't mean that there's confusion on anyone else's part, but I did want to bring it to your attention so that and maybe you might know better than I do. The Substance Abuse Prevention and Treatment Grant that we get from the federal government. Right now there's a little bit of a problem where the money seems to flow a little bit slow, and it has caused some folks, especially some coalitions, to not meet their funding expenses because of the way that the federal government rolls money in. There used to be a fund that was kind of for lack of a better term, a rainy day fund that was where this was not realized. During the Strickland administration, when times were really tight, that money was spent down to I think, I'm not kidding you, like $1.83 or something like that. So what has happened is they don't. The department does not have this money fix right now. They don't have this excess money where they can float people, float organizations this while they're waiting for federal funding. Well, to fix this, the department has said that they're going to stretch 6 quarters of funding over 4 quarters. However, Representative Driehaus tried to attach a $20 million allocation to fix this hole, so that there wouldn't be that stretching of funds and cuts that would have to be made over the and you know, this could kind of fill that hole that has been left because of the lack of a rainy day fund at the state level in the State Department. Representative Amstutz said that he thought this should be fixed in a separate bill. I know that there have been concerns, and this was in a story in the Gongwer, which is the State of Ohio's kind of newsletter, the State House newsletter. And I know that there was some concerns about this raised by the Ohio Association, OACBA, and Sherry at OACBA. We have the same concerns about this, as if this hole is not fixed, then we don't want this to cause hardship onto our providers who are doing such valuable work, especially in the opiate epidemic in communities. So what they did give a $3 million allocation as part of that $47.5 million for small SAPS providers that may experience cash flow issues, so they don't close shop. But that doesn't help the overall problem. I mean, it helps a little bit, but it doesn't fix the overall problem. I talked to the state yesterday, and they had a different story that they thought that that there was money given in the MBR grant, so or I'm sorry, the MBR bill. So it was an interesting. I'm still trying to get answers about where we lie with that. Whether the news story that we saw was correct, or whether the state actually did receive the funding fix to get this amended at the statewide level. Right now, I just listed out, the SAPS grant covers, we receive about $62.2 million from the federal government for prevention and treatment. A lot of the prevention providers actually get the money, get their monies from this. Nearly 2/3 of it goes to the county boards. Less than 1/3 goes to providers, and then 5% goes for grant administration out of this SAPS grant. So this is, this can really hit county boards, especially hard if this truly is not fixed. But again, I'm trying to get some answers on that, on whether this was actually, whether the news story was incorrect, or whether there was some confusion that on my part about it. But I did want to bring this up, that this was a part of the bill. There was some kind of fix that was attempted, but again, Representative Amstutz wants to fix it in a separate bill, he says. So there's a little bit of confusion about that, but did want to bring it to your attention that this and this will happen July 1st from what I understand, this 4-quarter or 6 quarters over 4 quarters type of funding. So wanted to inform everybody on that. Marijuana, wanted to continue. Have they gotten the signatures? Everything that I see points to no, they have not gotten the signatures. They have until July 2nd, which is less than 3 weeks away, to probably get about 200,000 signatures. You know, they continue to claim victory, how many people are behind this, you know, all of this kind of stuff. I know that the Ohio Rights Group is going to be on the Mike Trevisano show in Cleveland on Thursday. You know, if you're in a mood, you might want to call and you know, ask him some tough questions. I know I might. But that will be on Thursday, I think, at 4 o'clock, and you know, it doesn't look like they're getting their signatures as of yet. The marijuana policy projects, the national organizations are giving them no help. They're not providing any funding. There are a couple of folks from Nevada and California who have given them, you know, very tiny donations. But you know, the big guys are not giving the money that they normally give, because they're focused on Oregon and Alaska having full legalization. In the next couple weeks, I actually helped a group in Missouri come up with sector sheets talking about marijuana's impact on business, education, faith, the medical community, law enforcement, parents, and youth. And we're in the very, you know, we're in the I guess the lipstick and rouge phase. We're prettying them up before we release them. These ought to be done in the next couple weeks. That we'll put on the website, and you know, please use them as they go. It'll be you know, some stats, some things that might be of concern to each of these communities. So if you're meeting with you know, meeting with a pastor or something, you can just take the faith, the marijuana, how it impacts the faith-based community. The business sector, you know, you could take a sheet, so it doesn't have a lot of, I guess, information that doesn't matter to each of these sectors, and it kind of goes out and gives them just what their concerns might be. So those ought to be done in the next couple of weeks. And like I said, we're in a lipstick and rouge phase right now, so it should be we're hoping it's a valuable resource for all of you out there. Also, I know that some of you are doing some talks in your community. I got a notice that Brenda Heidinger up in Mahoning County is doing a business speaking to her safety council. She's the executive director of the Mahoning County board up there. I think that is absolutely so important, and just am thrilled that so many of you are doing these, getting the word out, whether it be in front of groups or, you know, just individuals in your own conversations. You know, continue to push this, because Colorado is starting to fall apart. When you're talking that 13% of all marijuana, of all traffic fatalities, involve someone, since 2010, involve someone with marijuana in their system, you know, things are starting to fall apart. You know, the edibles are literally have killed a couple people because of the issues, not overdose, but they'll take them, have a psychotic episode, jump off a roof, or they kill their wife, and those things have actually happened in the last few months. Also, you know, the impacts on learning, the impacts on schools, with kids getting kicked out of school, and all of these other things. Things are starting to go bad, and as Governor Hickenlooper out in Colorado keeps saying, this is, you know, he's telling other states, hold off on this. we don't know how this is going to turn out. So there are things that are not going very well. New York Times had there was an op-ed that was done by one of their reporters who actually went out to Colorado and decided to eat, I guess, one of these marijuana candy bars, and she couldn't get off the bed. She had an awful reaction to it. She had hallucinations. She couldn't leave her room. She couldn't get up out of bed, and I mean she had an awful reaction to it. So and she wrote about it, and she was pretty much told she was a lightweight and everything else. But it really does show. And then what's happened with that candy bar was the packaging didn't say that you should only eat 1/16 of the candy bar, and she ate the whole thing. So labeling seems to be a big issue in Colorado. So again, things are not going well in Colorado, and that's not good. But it certainly helps us in our work. That marijuana legalization is probably not the best thing to do for public health. CBD legislation, we continue to work on that. That's there was some talk about legislation being introduced in Ohio that would legalize marijuana used for kids with seizure disorders. We continue to push that there is a drug in the FDA process. It's actually going through human trials called Epidiolex, which would help young people, these young children. It would be under doctor care. It would not be some dude, actually these 5 brothers growing the plants in a greenhouse out in Colorado. That it would be safe and sterile, and you could actually study the effects and whether it has any long-term consequences or long-term fixes. So we continue to push for that. Also, the federal issue, a few weeks ago you may have seen a story that the House, the United States House, surprisingly, defunded the Department of Justice for enforcing marijuana laws in states with medical marijuana programs. What this would have done would basically, if there was any kind of, even though it's a federal offense, it's still a federally illegal Schedule I drug, the Department of Justice would not have had any funding to actually enforce any kind of federal laws in medical marijuana in states with medical marijuana. Well, and interestingly enough, it's been Republicans have usually voted for, have been a little bit wary of supporting medical marijuana laws. However, the House is controlled by Republicans, and they voted this way anyway. The lobbyists at Capitol Hill are doing, for the marijuana industry, are doing work to try to get as many legislators on their side as they can. And now but what's interesting is, so it's went over to the Senate, and the Senate, which is controlled by Democrats, have said, we've had some real concerns about this. So they have actually stripped that language from the bill, from the Department of Justice bill, and I guess reallocated funding to enforce marijuana laws in medical marijuana states. Now, this is not passed yet. They're waiting for a floor vote because Senator Dianne Feinstein, who is the head of the Justice Committee at the federal level, has said that she will, she's seen it in California where she serves, and some of the troubles that have happened, and will not support leaving this type of language in the bill. So they might try to bypass committee and just take it to a floor vote. I will continue to update you on this. I'm working with some folks at the federal level to try to flood Congress with letters from our side saying, I guess basically saying that we need the federal government to enforce marijuana laws, even in medical marijuana states. So I'll continue to update you on that. Next steps, I know we have a couple minutes left here, I think. Do we? 5 minutes? Okay. And just we have the session is going, Ohio session, General Assembly down here in Columbus, is going on recess, summer recess. They'll probably be back, I'm guessing, October. And then following that, there's something called the lame duck session, which basically is there's a flurry of bills that will be introduced, that will go through very quickly. I wanted to see if there were any bills that we might want to take a look at. I talk a little bit about the CBD and the marijuana. Is this something that we would want to pursue? Powdered alcohol, which I'll have a slide on in just a minute. Is this something? Do we want to try to ban powdered alcohol, which a couple of other states have done in the country? It should be legal in the United States in the fall. And is this something that we want to do as Ohio to stop this product from being sold in the Buckeye State? Also, the SAPS funding fix. Again, I need more information. Are there other issues that we might want to look at to get passed through the General Assembly? Again, it's a very quick-moving session. It's amazing how many things get passed and how many things fly through the General Assembly. So, if you have any ideas or anything like that, please forward them to me so that we can possibly start looking at these as something we might want to do during lame duck sessions. Powdered alcohol, again, there's labeling concerns. It could become legal in the fall. Senator Chuck Schumer wants the FDA to ban it because he calls it the Kool-Aid for underage drinkers. Palcohol, which is the product that actually, that's the brand name of the powdered alcohol. Some of their claims are it's for outdoor activities, perfect for hikers. Adults can travel and carry their favorite cocktail. Also, it's medical. You can use it as an antiseptic in remote locations. Energy, you can use it as a fuel source, so power your camper stove as an emergency fuel pouch. I mean, it's interesting. But then, some of the concerns that kids would snort it to get a quick drunk, that it's easier to snake around because it literally is kind of it looks like the packs I've seen on have been, they look like those little juice, what are those things called? The little juice packets. Capri Suns, thank you, Derek. The Capri Suns, they actually look like that. So they're about 4 by 6 inches. Easy to spike a drink. You can sprinkle it on, whatever. Ice cream, I think they keep saying you should sprinkle it on for whatever reason. All kinds of different foods. And then kids will get a hold of it easier, even though it's sold in the liquor section. So, these are some concerns that I have with powder alcohol. I'd actually like to start a work group to start looking at this and to possibly introduce something, or for us to start introducing some local ordinances in our communities if folks think that would be a better way of handling this. So let me know what you think of this and if there are any ideas for the lame duck session. So are there any questions or anything?
We don't have any questions right now. Kenton, I see that your hand is raised, so if you have a question, please enter it in the question section of the GoToWebinar navigation pane. Also wanted to let you all know that the next advocacy call will be on July 8th at 10 o'clock. Also, we have a webinar on increasing community awareness related to gambling this afternoon. And Tony, did you want to talk about the solstice on the solstice?
Oh yes, we have an awareness event coming up where we're holding at the AD Faro, which is a Harley-Davidson shop in Delaware, Ohio. It's right off of Interstate 71, and it's for opiate abuse and misuse. It's a public awareness piece where we're having motorcycle riders come in, learn about the program. It's going to be an outside program. It's going to be lots of folks coming there, lots of fun things to do. We will have education from the stage. We're also going to have some fun things. I'm going to have a fried bologna eating sandwich contest up on the stage. I also want to do, as gross as it sounds, I want to do some back shaving for whatever reason. I don't know why I want to do that, but I do. So it should be a fun day. It should be a day that will also get some folks' attention in motorcycle communities. That this can be a problem. So it should be a day, and we would really appreciate your support. Also, we are having a raffle of a Harley-Davidson motorcycle the day of. So it should be a fun day. It's free. Obviously there is cost for food if you want food, and then if you want to register, if you actually want to ride in it, there are a couple of different regional sites. Cincinnati, the Coalition for a Drug-Free Greater Cincinnati, is hosting our site, or our regional site down in Cincinnati, and so folks from Southwest Ohio could take off from there. In Springfield, folks are working with Cole's Warriors and FYI up at Springfield, and people can take off from there. And that's they're going to have a fantastic program as well at their regional site. Portsmouth, Joanna Crone and the Solace group down in Portsmouth will be hosting the regional site down there, sending off bikes. And this is 11:30 to 3 is the thing in the event in Columbus. And Columbus will actually be taking off from the American Motorcycle Association. It's the Motorcycle Hall of Fame or group that's out in Pickerington. So it's kind of a statewide Southern Ohio event. People will be meeting there. We're expecting tons of bikers and tons of families to be there. Would really, really love to have you there. Also, if you want a table for people to know what is in their own communities, share information, those we're offering free to everyone. So if you want a table there, like I said, there should be a lot of folks there to get your story out there, to get your organization's footprint a little bit wider. We'd be more than happy to give you that table.
Antonio, we have a question from Jamie. She'd like to know if we have an advertisement for Facebook or other social media for this event that we can share with them.
Yes, we have been posting on Facebook and Twitter the last few weeks, and we can certainly send that to you. I know that Marcy is going to be sending out another one of these very, very soon. And we've been sending out some videos as well where people have been where we've taken clips from people who have been affected by opiate misuse and abuse, sending them out to get some awareness as well. So we encourage you to use those, and like I said, Marcy will be sending those out, so please spread it far and wide. So thank you so much, Jamie.
And that's all the questions that we have for this time. Thank you again for joining us this morning. If you have questions, please feel free to contact Tony at tcoder@drugfreeactionalliance.org or call us at 614-550-9985, extension 17. Thank you again for your time this morning, and we'll look forward to speaking with you next month. Have a great month.